Okay, good morning, everyone, and welcome to our Healthy Northeast Ohio webinar, Local Efforts to Increase Food Security. Thank you for joining us. We are going to go ahead and get started. All lines have been muted, and we do ask that your microphone remains off so that we can maximize our audio quality for all of our speakers. And if you do have questions or comments as we're moving throughout the webinar, please do add those to the chat box and address them to everyone so that we can ensure that we receive them and address them at the end. My name is Livy McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio. I am based at the Center for Health Affairs in Cleveland, and I serve as one of the local site administrators for healthyneo.org. And I'm going to invite my colleague Sarah to introduce herself.
Thank you, Livy, and good morning, everyone. My name is Sarah Zabo. I'm a data analyst at the Cuyahoga County Board of Health, and I'm the other site administrator for Healthy Northeast Ohio. Thanks again for joining.
Thanks, Sarah. I know we may have a couple on the call who are unfamiliar with Healthy Northeast Ohio, so we will provide some background information about our efforts, in addition to previewing some of the health data and resources that are available to you on healthyneo.org. We are also joined today by Alyssa Glenn from the Greater Cleveland Food Bank, where she is the Director of Community Health and Nutrition, and we are very excited to hear from Alyssa in just a few minutes to discuss some of the food bank's wonderful programs that address food security across our region. Healthy Northeast Ohio serves a 9-county region. We do continue to utilize the Conduent Healthy Communities Institute web-based platform, and they largely maintain and curate most of the data that you'll see available on the site. And then as local site administrators, Sarah and I have the capacity to do things such as add local data. We're able to provide some custom content in terms of resources and tools and so forth. The site currently houses about 300 health and quality of life indicators in addition to demographic elements, and these are available at various geographic levels. And then, of course, to supplement the data, tools and resources are available to support community health improvement. Overall, our mission is to improve and support community health across our 9-county region by providing stakeholders with access to vetted population health data and resources through a publicly available platform. So all of the data and some of the tools that Sarah will be previewing in just a few moments are publicly available to you. The Center for Health Affairs and the Cuyahoga County Board of Health work collaboratively on this program. We do continue to be supported by a grant through the HealthComp Foundation in Cleveland and through generous partner contributions from across our region. We have the pleasure of coordinating with many of the hospitals and public health departments across our region, in addition to several community-based organizations and coalitions. So to all of those who are on the call and all of those who are listed on the slides, we thank you for your support. Today we are focusing on health equity and food insecurity. According to Feeding America data, we are going to be, you could see on the platform that about 12.8% of the population across our region has experienced food insecurity at some point during the year 2019. And as we've seen through the news and as we've seen through many things recently in light of COVID-19, this is something that's been heightened. And as Alyssa will discuss momentarily, food insecurity is also associated with chronic disease, which is also a priority for many of you working in our region who are supporting community health outcomes. So during today's session, we are very pleased to provide you with some additional data and resources that may assist with addressing these efforts in your community. And with that, I'm going to turn it right over to Sarah Zabo for a data preview.
Thank you, Libby. I'm going to go ahead and pull up the website, so just bear with me. Libby, are you able to confirm you see the website?
Yep, I am seeing your website.
Okay, perfect. Thank you so much. Okay, so now that Libby has so nicely set the stage and given you some background on Healthy Northeast Ohio, we wanted to take just a little bit of time to do a quick show and tell of some of the data that we have related to food insecurity, and then some additional resources that Libby alluded to that we have available on the website. So what you're looking at right now is a custom dashboard that I made looking at our food insecurity topic area on the website for our Healthy Northeast Ohio region. So again, that 9-county region that Libby mentioned. And these indicators come from a variety of sources such as Feeding America, the American Community Survey, and the National Center for Education Statistics. And these custom dashboards allow you to see a summary of the data that you've pulled in, as well as any available comparisons. So comparing your community to other locations or things like national benchmarks. And again, if you're not familiar with the website, we also have an indicator list by location page that can give you a sense of the additional food-related data that we have available. So here we're looking at 4 indicators for the region. So we have the child food insecurity rate. So the percentage of children living in households that experienced food insecurity in the past year was 17.8% as of 2019. And if you look at this by county, we see that the rates are highest in Ashtabula and Cuyahoga County. And then the comparisons again to the right, we can see how is our region comparing to the state. So here we see that our region is doing a little bit worse than the overall state value, but it does look like compared to the previous year, our rate has gone down just a little bit. We also have food insecurity rate, which again, Libby said was 12.8% as of 2019. We also have households receiving SNAP with children. So the percentage of all households receiving SNAP that have children in them was 42.4% in 2016 to 2020. And there we're also seeing that our region's current value is a little bit lower and better than the state. And compared to the prior value, the current value is lower and better. And then lastly, we also have students eligible for the free lunch program. So this is the percentage of students eligible to participate in the free lunch program under the National School Lunch Program. And that value for the region was 16.3% in 2019 to 2020. And I just wanted to real quickly show you all how you can dig a little bit deeper. So if you click on an indicator, so I'll click on students eligible for the free lunch program, you are taken to what's called the indicator detail page, where again, we can dig deeper so you can see a description of this indicator, some text about why that indicator is important. You'll again see the value for the region and then those same comparisons we saw on the dashboard. And then if I scroll a little bit more, you're going to see a change over time graph, and some indicators on the website do have breakout data available. So if that was available, you'd see that there as well. And then I did want to show down here, this is where our maps show. So if I click on the county tab, we can see how these rates are ranging across our region. So the darker the blue, the higher the rate in this map. And the range across our 9-county region is 12.8% all the way up to 31.9%. And we're seeing for this bar graph to the right that the highest rates are in Ashtabula and the Ashland counties. And again, just as a reminder, all of the maps and graphs are downloadable just by clicking at the top right of any of those. And then next, I'm going to move into showing you the Socio-Needs Index suite, but more specifically, the Food Insecurity Index. If you have not already visited this on the website, I'll kind of walk you through that. So this is a fairly new tool that our vendor Conduent launched earlier this year. And it's a tool for assessing, planning, and collaborating on community health improvement. And it can be used to identify under-resourced areas down to the zip code and census tract levels to help inform local decision making. So you can see here that this suite does include 3 indices. So we have a health equity index, which can be used to identify areas at highest risk for experiencing health inequities. We also have the food insecurity index that can be used to identify areas at highest risk for experiencing food insecurity. And then we also have the mental health index. So this can be used to identify areas at highest risk for experiencing poor mental health. So as promised, I'm going to go ahead and click on the Food Insecurity Index. So this index combines multiple indicators into one composite score, so you can more easily identify areas that again are at highest risk for experiencing food insecurity. And it's calculated using a variety of indicators related to topics like income, household environment, and well-being. And in a nutshell, you can see here a description of how this tool works. But basically all counties, zip codes, and census tracts are given a national index value that ranges from 0 to 100, with 100 being high need. And then those national index values for each location in a community are ranked from 1 to 5, with 5 being high need. And you can read more right here by clicking how does it work. And then if I show you the map here, the darker the shade of green in the map indicates a higher relative level of need within the community. And again, right now we're looking at, this is zip codes across our whole 9-county region. I did want to just point out down here that you can filter this if you're interested in looking at a particular county, or if you want to switch to looking at either the county or census tract level. And then just to kind of wrap up this tool, a few ways that you could use this index is obviously one, it helps us to tell the story of food insecurity in our region. And because the data is available at that, sub-county or more granular level, it does allow you to be more specific when planning where to focus efforts. And then also it can help bring cross-sector partners together to identify those areas for shared action. Okay, so another tool I wanted to highlight, so once you've looked at the data on the site, as I said, you can combine it with either other data or promising practices, resources or funding opportunities that I'll kind of briefly touch upon before turning things over to Alyssa. So this is the promising practices database that we have on the website. And over on the right, you can see that you can do a pretty specific search. So if I wanted to look, for example, for promising practices to implement related to food insecurity, I could do a keyword search for food insecurity, and then you're going to see different ranking levels. So either evidence-based practices, effective practices, or good ideas. So I've just filtered this by evidence-based practices, and you can see that I have 23 results. And if you did click on, I think I have the tab open to cheat a little bit on time. If you click on one of those promising practices, you're taken to a page where you can dig deeper. So you can see a description of it, the goal, the mission, things like the results, accomplishments, and even contact information for the person who submitted that promising practice. So again, just wanted to point that out as an additional resource available to you. And then lastly, I wanted to mention that we also do have a resource library in addition to a funding opportunities database that can also be used if you're interested in searching for food insecurity related resources. So our resource library currently contains about 400 community health resources, and we do have those organized into collections. So you can find things like website links, reports, articles, videos, etc. And then our funding opportunities database allows you to search for grant announcements that are mainly from large foundations and the national government. So that ends our website demonstration. So I'm going to go ahead and stop sharing. And I'm pleased to turn things over to our guest speaker again, Alyssa Glenn from the Greater Cleveland Food Bank. And she's going to be sharing about local efforts in addressing food insecurity, as well as the impact of COVID-19 on food access. So Alyssa, the floor is yours.
Thank you. Can you hear me okay? Okay,
yes,
great.
Yes.
Thank you for sharing all those great tools. I'm looking forward to spending a little time on there and playing around. There's a lot of good stuff that you just demonstrated. So my name is Alyssa Glenn. I'm the Director of Community Health and Nutrition at the Greater Cleveland Food Bank. I've been at the food bank for about 5 years, working primarily with our healthcare providers and on initiatives that are really oriented towards improving health outcomes through the services and programs that we offer. So this presentation has some information about food insecurity generally. It has some information about the Greater Cleveland Food Bank, also some information about the relationship between food insecurity and health outcomes, and then the programs and services that we offer to try to improve health outcomes. You can go ahead to the next slide. This shows a picture, of course, of some beautiful produce, but also a snapshot of our warehouse. Our mission is to ensure that everyone in our communities has the nutritious food they need every day. And we have a pretty large facility. It's about 130,000 square feet on South Waterloo and 152nd. We are in the process of an expansion, and so our warehouse will be moving off Coit Road, not too far away. And our current facility will be renovated into a community resource center. So some exciting developments over the next year or two. Next slide, please. So one thing that's always good to just clear up front, if you're not super familiar with food banks, is that there's a big difference, generally speaking, between food banks and food pantries. So when you think about a food bank, we're really talking about more of a food distribution center. So we accept food, we accept donations, we purchase food, and we store it in our distribution center and then distribute it primarily through our community partners, which I'll talk about in a couple of minutes. So this is, contrasted to a food pantry, which is a smaller type of organization that distributes food directly into the hands of those who are food insecure and need those resources. We are one of 200 Feeding America food banks. Feeding America is an umbrella kind of organization that provides resources and services to 200 food banks across the country. We also receive support from the Ohio Association of Food Banks, which provides resources to the 12 food banks in the state of Ohio. Next slide, please. Every county of Ohio is covered by an Ohio food bank. So this is a snapshot of our service territory. We serve Cuyahoga, Lake, Geauga, Ashtabula, Richland, and Ashland. As I said, every county in Ohio is covered by a food bank. The numbers to the right of the screen are the most recent estimates from Feeding America on the number of individuals believed to be food insecure in each county. So these numbers have fluctuated tremendously throughout the pandemic. Early in the pandemic, numbers were skyrocketing as some of the pandemic supports came out, the checks that people were receiving, the child tax credit, the numbers went down dramatically, and now we're kind of leveling out a little bit. Next slide, please. These are some numbers on our impact. Our fiscal year runs from October to September. So just to give you an idea of the scope of food that's provided by the Greater Cleveland Food Bank out to those 6 counties, we've served around 350,000 people in our fiscal year 21. That's about 1 in 5 people in our service territory. That includes about 36,000 children. It's also a really big initiative of ours for about the last 10 years actually, to try to connect people to SNAP as much as possible. So in that one fiscal year, we submitted about 11,000 SNAP applications. And then total number of meals provided, that's based on the amount of food we provide, is about 52 million meals. Now, frequently we get asked where our food comes from. So the chart to the right of the screen shows what our food sources are. We purchase about 22% of our food. So the donations that we receive are largely used to purchase food. And actually there have been some policy changes over the last year that are increasing the amount of food that we need to purchase. And then of course we all know that there's a lot of inflation, so our food costs are increasing recently as well. But other than that, we do receive a significant amount of donated food. About 1/3 of our food is donated. That has been trending downward recently due to just national and global trends. But we also receive a lot of food from the USDA, and we have some really significant contracts with the state. So we have 2 different contracts with the state, one of which provides funding for us to purchase food, and another provides surplus produce from Ohio farmers. So that is actually relatively unique across the country, this type of contract, and it provides a lot of the fresh fruits and vegetables that we're able to offer throughout the summer and fall season. Next slide, please. As I mentioned, in our past fiscal year, we served about 1 in 5 people in our counties. That's a fact. And actually, in the peak of the pandemic, we served about 1 in 4. So that's always just shocking to me to know. If you're thinking about the scope of food insecurity, just think, that's probably the easiest stat to remember, is that over about the past year, we're serving 1 in 5 people, 1 in 5 of our neighbors. Next slide, please. So this is a snapshot. It's a lot to take in, but I'll walk you through it. This is a snapshot of our network of partners. As I mentioned, primarily, and this shifted a little through the pandemic, but primarily the food that we distribute just gets into the hands of the folks who need it through our partner programs and agencies. So we're more of a distribution type of organization, and we distribute the food to other organizations, and they're the ones who give the food out into the community. So this shows those different areas of programs and services they're actually distributing the food. So when you think about your traditional brick and mortar pantry, you can see there's a pantry box there, and it's about 239. So we have 239 brick and mortar pantries that we provide food for in those 6 counties. A lot of those are very small organizations like church pantries being serviced by volunteers. One of the things that happened in the pandemic, because a lot of the volunteers that staffed those pantries were at the highest risk for COVID, they started shutting down and closing hours. So we had to shift our distribution a bit, and I'll talk about that a bit later. But that's a very traditional model for food deliveries through a pantry. We also have what we call mobile pantries. These are where you see our trucks in the community. We load them up with several thousand pounds of fresh fruits and vegetables. They go to a partner location, typically at the same day and time of the month. So for example, it could be the first Tuesday of the month from 10 to 12. That might be the distribution of the mobile pantry. And what's set up by our partner is something like a farmer's market type experience where folks in the community can receive fresh fruits and vegetables. So we have about 150 of those. Our senior markets are the same model, but at senior housing facilities. School markets, also the same model, but at schools. And then we have some other senior programs and some other children's programs, such as, for example, the backpack programs. We have about 50 of those. Those are where primarily schools, but also some healthcare providers receive backpacks with 3 days worth of food. And those are meant to get children who receive aid at school in the form of school lunch additional resources to get through the weekend fully nourished. And then my area of expertise are these food as medicine sites. These are programs that are offered at our healthcare providers within our region. Next slide, please. Feel free to pop questions into the chat also. I'll do my best to monitor. Okay, so moving on to food insecurity and health outcomes. Food insecurity does have a very specific definition offered by the USDA. It's defined as limited or uncertain access to enough food for all members of a household to live an active and healthy life. And it's important to acknowledge that within this definition, the quality of the food is specifically called out. So we're not just talking about hunger, we're talking about the quality of food to be active and healthy. Food insecurity affects about 43 million Americans. That's quite a high percentage. Again, it's a little bit less than 300,000 at the moment in our service area, including about 83,000 children. And the graph of the US on the right there, it shows that Ohio is higher than the national average as far as food insecurity goes. It's also worth knowing that Cuyahoga County is relatively higher than Ohio, and then it continues to become more concentrated when you get into the urban core. Next slide, please. I always want to point out that food insecurity and poverty are not necessarily the same thing. They're certainly closely related, but poverty is defined very strictly as an income level at a federal guideline of income level. Food insecurity gets a little bit more complicated. So you can technically meet the federal guidelines for poverty and not be food insecure. You can also have the opposite. So it arises as a result of more complicated factors. Next slide, please. So this is a way to conceptualize some of those more complicated factors and difficult choices. So this slide and the next slide show some of the results of research that came out of Feeding America several years ago. So there were some surveying done of folks who are utilizing the Emergency Food Network for food resources. And this research showed that 64% of the people surveyed had to choose between paying for utilities and food. 65% had to choose between paying for transportation and food. 62% between paying for medicine and food, and 54% between paying for housing and food. So you have these multiple resource demands and a limited number of funds, and you end up making difficult choices that frequently affect your ability to buy the quality and quantity of food that you need. Furthermore, 78% of clients reported purchasing unhealthy food to stretch their budget. So that's really, provides some understanding about how food insecurity can affect the quality of food as well. Next slide, please. Another statistic that came out of this same research was that among the households that our food bank is serving, 61% of households had a member with high blood pressure. and 30% of households had a member with diabetes. So again, this was really the first large-scale research that was done within the food bank community as a whole, and then specific to each service territory. So it provided a big wake-up moment for a lot of food banks to start to really understand how food is affecting people's health and to start to grow partnerships with people who may be able to help more deeply. So example, healthcare providers. So after this research was done in 2014, we've seen a lot of increase in relationships between food banks and healthcare providers, trying to work together to understand how to more directly improve the health outcomes of their patients. Next slide, please. I have a few more slides on food insecurity and health outcomes. This slide is specific to chronic disease. So we know that the relationship between food insecurity and chronic disease works in a couple of ways. First, food insecurity increases the likelihood of developing a chronic disease. And there is a bucket of research that's available. These statistics are all based on peer-reviewed published literature. So we know that the relationship between food insecurity and hypertension and diabetes is that you're 25% more likely to develop those diseases if you're food insecure. Kidney disease is a little bit more, 50%, osteoporosis, 400%. And then secondly, once you have an established chronic disease, food insecurity makes it harder to manage that disease. So diabetes is a great example that's fairly easy to understand how this works. So if you have diabetes, it increases your number and scale of tough choices that you have to make. Are you going to spend your money on the medication that you need? Are you going to spend it on food, quality of food? Do you spend it on transportation? You have more of a need to go to doctor's appointments at this point. Of course, your housing is still important. We know from the literature that food insecurity decreases medication adherence. And we know that diabetics who are food insecure have worse glycemic control and more emergency room visits. So it's really affecting that ability to manage the disease. Next slide, please. This slide has some data on food insecurity and health outcomes for children specifically. The American Academy of Pediatrics formally endorsed screening for food insecurity among pediatric patients many years ago. And the reason for that is shown in this light blue box. There's a relationship to health outcomes in food insecure children. For overall health, more hospitalizations, higher risk of developmental problems, lower cognitive indicators, nutrient deficiencies, reduced academic achievement, higher rates of mental health issues such as depression, anxiety, and toxic stress. And we know that just in Cuyahoga County alone, we have about 61,000 food insecure children. So quite a significant issue in the area in which we live. And then, of course, these health issues don't just disappear when childhood ends. When you turn 18, your food insecurity, the effects of your food insecurity doesn't go away. These translate into poorer health outcomes as an adult as well, both physical and mental. Next slide, please. So my last slide on food insecurity and health outcomes, and this data is specific to a low-income working age population. And what's a little bit different about this slide is that the rate of food insecurity is divided out into 4 different levels. So some of the longer screeners for food insecurity that have been created by the USDA differentiate between these 4 levels. So if you look at the light blue bar on the left, you can take hypertension as an example. The light blue bar indicates folks who are very food secure. And as you go to the right and the bars get darker, you're increasing the level of food insecurity. So the dark blue bar is a very low food secure population. So for this example, the predicted prevalence of hypertension among a low income working age population for those that are very food secure is around 17%. As you get up to very low food secure, the risk of hypertension increases, or predicted prevalence of hypertension increases to about 27%. So you see this very significant relationship across many different chronic diseases. Next slide, please. Okay, so that's the background, and now we're going to move into what the Greater Cleveland Food Bank is really doing in this space to partner with healthcare providers and try to address food insecurity and health outcomes together. The first thing is we advocate and work with partners who are screening for food insecurity. This work is really on the rise. We have many wonderful partners. All of the major hospital systems are currently screening for food insecurity among a significant percentage of their population. And this is the go-to screener. It's like more of a diagnostic screener. It's just 2 questions. It's called the hunger vital sign. I won't read it to you, but if a individual indicates often true or sometimes true to one or both of these questions, they're believed to be food insecure. So this is the go-to screening tool that's being used in healthcare settings to understand if someone's food insecure. And there are some best practices with this screening tool. One, I'll just mention a couple. One is to use it regularly. So, when you see the patient, it's best to screen them. This is because food insecurity can come and go. Someone who's not food insecure 1 month may be food insecure the next because their situation may have changed. There may have been an employment change in status. There may have been a breakdown of a vehicle, who knows, could be anything. But the important thing to know is that it does change. Most of the people who utilize the Emergency Food Network are only coming once or twice over the course of the year. So the need arises, and it's best to know if it's there so that you can direct them to resources. The second thing I'll mention is that asking in writing is more effective. This is a sensitive topic to question people on. And so you'll actually see among similar patient populations that if you ask on a paper form or on a tablet, that the rates of food insecurity that you find from the screening are higher than if asked verbally. So that's something to think about if you're considering implementing a screening process where you are. Next slide, please. We have a few different buckets of programming available for our healthcare provider partners. And I'll just go through each of these buckets pretty quickly because I know we're running a little short on time. The first kind of concept in area of programming is the idea of a food intervention or prescription. So we have several partnerships where our healthcare provider partners have on site a full-scale pantry. We refer to them as food as medicine clinics. Our partners have different things that they may call them. But the idea is that a patient who is food insecure and may or may not have a qualifying chronic condition, but if they're food insecure, they're directed to this on-site resource with very nutritious food with the intention of improving health outcomes. So the patient is actually provided a prescription to access regular nutritious food, with the goal being that they come to pick up that food once or twice a month over a period of time and then see some improvement in their health. So again, this is a model that's increasing across the country as well as within our region. Another thing that we do is offer those produce distributions or mobile pantries. So this was popular for a while with our FQHC partners to offer produce on site once or twice a month. We've since started offering these at a number of different type of providers. We have some hospital systems taking advantage of produce distributions. We have some dialysis centers taking advantage of some of these produce distributions. One of the nice things about these is that they're completely free. The hardest thing for our partners is to find the staffing for it because it does require some volunteers over a couple of hours. But again, this is a delivery of fresh fruits and vegetables once a month. You can have more if you want, but we require a minimum of once a month in an area of high need to increase the access of fresh produce for the community. The third area of programming that's expanding quite a lot is referrals to our help center. So if you are screening for food insecurity at your site and you know that your patients are food insecure and you don't have food on site, or even if you do, we really strongly recommend that you send the information for that patient to our help centers so that we can reach out to them and connect them to food resources. We actually created a new position to service these referrals. This is our root cause coordinator for healthcare programs. Her name is Dia, and she's wonderful. So if we receive a referral from a healthcare partner, Dia will call that patient back and have a robust conversation about what their needs are. So she may send referrals out into the pantry network. She can open up a Google map and see where the patient's located and say, here are all of the resources that are close to you. There's also always going to be a conversation about SNAP. If the person is eligible for SNAP, we can help to submit that application. And there will also be conversations about what other resources might be useful. There's a pretty robust landscape of resources for seniors. So if the patient is a senior, we can connect them potentially to additional resources such as home delivered food, Meals on Wheels, etc. So there's quite a lot of resources that we're able to connect people to. And then the fourth area of programming, I'm just calling specialized programs for now, but we are developing targeted nutrition interventions for certain populations. Nourishing Beginnings is an example of one. This is aimed at improving health outcomes for women at high risk of poor birth and infant health outcomes. This is a partnership with Better Health Partnership and Case Western Reserve. So for us, this is both a new program, but it's also a research study. So we're really going to be looking closely at the impact of this increased food access for this high-risk population. Next slide, please. This is just a little more information about our help center and outreach team. As I said, they're not just focused on food resources, although of course that's a huge priority. So when it comes to food resources, we're always going to understand if people are eligible for SNAP. For every $1 of food that we can connect people to, SNAP provides $9. So it's an incredibly important resource for people if they're eligible. And we have the relatively unique ability to help submit those applications for folks. So we'll always screen people for SNAP. And then, as I said, we can connect them to emergency food sites within their community. And then we have additional resources we can refer people to, resources in housing, employment, and healthcare as needed by the patient. Next slide, please. So this crazy looking thing, this is actually a snapshot of our Google map. So when folks are connected to our help center or to our root cause coordinator for healthcare, what they will do is pop open a Google map and it will show the landscape of resources across the community. So those 1,000 programs and partners that I referenced, they're all on this map. So we can zoom in, enter someone's address, zoom in, and really tell them very specifically where the mobile pantries are, where the pantries are, where the hot meals are. If they need WIC, we have WIC offices on here. All the resources that we have connections to are on this map. Next slide, please. The snapshot of our partners, we can kind of breeze through that. So I know that there was some interest in our COVID response. You can go to the next slide. This is a picture of our Muni lot distribution. So this is not something that we did pre-COVID, but as the needs for food insecurity or as the needs for food were increasing and pantry locations were shutting down, having locations shut down and need increasing was a bad combination. So what we did to adjust was offer this once a week, very large scale distribution. We were helped to establish it by the National Guard, which was incredibly helpful. And we're still doing this once a week, every week on Thursday at the Muni lot. And so anyone can register for this online. It's a simple drive-through model. If you're registered, you put your number, your registration number up in your window, you drive through, your registration number will help us know how many households of food you've reserved. You can actually pick up to 4, I believe. And you drive through and we just load it right into your trunk. So very efficient. And we're still serving just a little shy of 2,000 households every week through this model. You can go ahead to the next slide and I'll wrap it up here. So this is some data. This is actually the y-axis shows the number of households served and the x-axis shows dates through our Muni lot. So this basically shows the pandemic period and how our service changed throughout the pandemic. And then what you'll see in writing there are some of the public supports that came through during the pandemic. So you'll see, if you look to the left there, our first weekly food distribution, which actually happened on site at the food bank, those are blue. And then we shifted to the Muni lot because the need was so high, we just did not have the space. I think we shut down traffic on the freeway for a few hours. So we had to move to a different location. So you see early in the pandemic, the need just absolutely skyrocketing up to, I think it's a little over 3,500 households that were served through our Muni lot distribution. And then you start to see some of the supports coming out. So the first stimulus check came out and then you see the needs start to decrease. And you see that pattern. I'm not going to spend a lot of time on it because I know we're almost out of time, but if you look closely at this chart, you're going to see the need go up and then they go down when public supports are received. So the stimulus checks, the child tax credit, the need goes down. So it's interesting to look at this and just spend a little time with that and see that relationship. And I think I'm gonna wrap it up there because I know we're at time. And I'm happy to share these slides so anyone can read them and access them later.
Thank you, Alyssa. That's great. I'm going to go ahead and go to your last slide just with any questions or comments from the audience. So please do add any questions to the chat box and address those to everyone. And we'll gladly take those for the next couple of minutes. Thank you so much, Alyssa. This is amazing to see the work of the Greater Cleveland Food Bank. I know you guys are a powerhouse in this space and that you're really doing a lot to address food insecurity and improve the health of our communities. So we thank you guys for your efforts. And I remember seeing those images that you had in that first COVID slide with the miles long cars of people waiting to get, their food because the need was just so high during those times. So we know again that you guys are working tirelessly for this. So it looks like we do have one question in the chat. And the question is, I know the food bank is on Unite Us, but is there a breakdown of each of these types of programs, or do you just refer once you get the initial referral?
Yeah, thank you, Meredith. We are using Unite Us to receive referrals, and really you can just send us a referral for food, food assistant or emergency food. I don't remember exactly how it's put in there because we're going to treat everyone similarly. So we would prefer that the referral be relatively general, and then we'll do the work to figure out what the best food resource is for all of those people. But that said, we will always love to talk to the groups who are referring so that we, and on a regular basis as well, like we're happy to spend a half an hour at your team check-in to just talk about all of the programs and services that we offer so that people who are sending the referrals know what we do, because we know it's helpful for you to have that in mind, to understand if the referral is really helpful and to try to prep the patient for what we can offer. But yeah, it's really best for us to just get a general referral and then we'll connect them to everything that they're eligible for.
Okay, great. Thank you. And then really briefly, before we pull up just some of our concluding slides, what is the best way to get in touch with you or your team? So for those who are within your service region who might be on the call or are listening back to this recording, what's the best way to get in touch with you to maybe partner on some of these programs if they're not already partnering with your organization?
Yeah, thank you. So I will put my email into the chat and I'll also put my phone number. So feel free to email me or give me a call anytime, and I would love to talk.
Awesome. That's great. Thank you so much, Alyssa. I know we have just a couple of slides to conclude with. Before we wrap up, please do feel free to reach out to our Healthy Northeast Ohio team at any time if you have questions or requests. And you can do this also through the Contact Us page of our website. And here's my email and Sarah's as well, in addition to our phone numbers. And then thanks, Alyssa. Alyssa did add her email address and phone number to the chat. So if anybody would like to grab that for reference later on, that is wonderful. And this concludes our webinar for today. So thank you again, everyone, for your participation. We thank you, Alyssa, for sharing this wonderful information, and we look forward to hopefully seeing you all again soon. So have a great day, everybody, and thanks so much.
Thank you, everyone.